In this video we will demonstrate roll glide assessment and mobilization of the first carpo-metacarpal joint into flexion and extension. Hi and welcome to Physiotutors. The aim of roll glide assessment is to gain information on reactivity of the joint as well as articular problems such as capsular limitations. The CMC1 joint is a saddle joint, so we will both roll and glide in the same as well as opposite directions depending on the movement that we will assess and mobilize. For flexion and extension, the trapezium is convex and the first metacarpal is concave, which means that the roll and glide move into the same directions. For this assessment, you can sit face to face of the patient. For the assessment of flexion and extension, the patient's arm can lie on the bench. With your heterolateral hand, grasp the distal carpal row from dorsal in a way that your index finger can stabilize the patient's trapezium. Then grab the first metacarpal bone as proximal as possible with your other hand between your thumb and index finger. This way you can easily assess the roll and glide during flexion and extension. For flexion, roll and glide into ulnar and slight palmar direction. For extension, roll and glide into radial and slight dorsal direction. For all techniques, assess for movement quality during roll and glide, possible pain provocation and end feel. For end feel assessment, roll and glide to end range. Then assess if further gliding is possible or not. In a hypomobile joint, the glide is reduced relative to the roll component, so no further gliding is possible. If you feel that the end feel or movement quality is abnormal, you can directly move further from assessment to intervention as the techniques are identical. In case you want to mobilize, you can use an alternative grip where you prop the patient's arm up on their elbow with the forearm in pronation. Then stabilize the distal carpal row with one hand from dorsal so that the index finger fixates the trapezium. Then grab the thumb with your entire hand. Then you can roll and glide into radial and slight dorsal direction to mobilize extension. To mobilize flexion, switch hands and roll and glide into ulnar and slight palmar direction. When used as an intervention, make use of the Maitland grades of mobilization to dose your techniques according to your goals. Check the video in the top right corner to learn more about that. In the video description, you'll find a handful of links to our ebook, app and online course. As always, please like this video if you found it helpful and leave us a comment down below if you have any further questions. This was Andreas for Physiotutors. I'll see you next time. Bye.